Morning. Welcome to the new year. So we are resuming our critical appraisal series and our course in critical epidemiology. Wishing all the participants a happy new year. Thank you for all the virtual participants also who have joined us. Thank you so much. So today we thought we'll do a new topic. So nowadays many of the manuscript submissions, many of the journals do ask for a visual abstract. And it is being projected like a tweet or a message or a WhatsApp message so as to disseminate information. But should that also undergo a critical appraisal? So we have identified one checklist to critically appraisal in infographic or a visual abstract as well. That is the Riva checklist. So we actually have who has kindly agreed to do the critical appraisal. And she will be telling us why we should be appraising it. And we'll also be going through a critical appraisal of one such aspect. And we'll also have hands-on activity once that session is over, so that we also mistake. I'll hand over to Mercy.
Good morning and welcome back to our CU session. Today I'll be looking at critical appraisal of infographics and visual abstract. So we will go through what is an infographic, why do we need to visually appraise the same, Riva checklist, and at the end we'll look at applying the same on a few of the visual infographics that we picked online. Like Sir had already mentioned that there has been a recent change in trends in medical research. Increasingly, it's like we're all getting used to reels and then always prefer to look at pictures more than full text. So increasing use of summaries, conclusions, and infographics are in play. With that is the one that the good side is that there's an increased attention to the research that is being done. But there's also a decrease in the full text reviews. So, but what is an infographic? So it is basically, it represents information visually using a combination of text, images, and data visualization. Like it is synonymous with visual abstract or a graphical abstract, popular tools to summarize the health and medical research. But having said that, are these infographics, summaries, and conclusions fully representative of the results of the study? Can we consider them to be a substitute for reading full text articles? And if yes, are they as good as full text articles? To answer these three questions, I found this article, and I mean, this is not, this is just a small part of the introduction to the checklist that we are going to do. So this is just to give us an idea of how big the problem is, what the problem is. So this is done by Ryan Muller, do infographics, spin the findings of health and medical research. This was published in the BMJ ABM in October 2024. So what is a spin? So essentially, it's misinterpretation of study results that overemphasizes the beneficial effect of intervention or overstates safety compared with what is shown by the results. They may be, so this can happen with either abstract or results conclusion. But infographics are uniquely prone to spin as compared to the abstracts and full text articles, because people want to limit the text that they want to put in the visual just for the appeal, and they don't want to make it look very clumsy. And there's also little guidance for infographic developers on how to report and what to report in the infographic as such. So I just summarized the study in 2 lines. It was a cross-sectional study. They had taken published RCTs with negative findings for at least one primary outcome. If they had taken primary outcome to positive studies, they are unlikely to become a spin impact. So they had taken ones with negative findings. Publication is only in the top quintile, so they have taken only top 25%, so they may not be fully representative of the rest of the papers around. They had used the Journal Citation Reports database. So at the end of it, they have picked 119 RCTs from 40 journals, but not more than 4 from each journal, so that there's more increased representation. Let's say a journal like the BMJ Visual Abstract publications are all journals. So we want to get just one journal, so not more than 4 from each journal. Interestingly, about 20% of them are from general medicine. They had looked at present spin, any spin and spin in the results and conclusions of infographic, abstracts, and full text between August 2018 and October 2020. So what did they find? They looked at it. There's about 33% of the studies there was any common spin within the infographics, abstracts, or full text. So that's a big number. So about 1/3 of them are actually not representing what is the truth. But on the other hand, interestingly, the infographics did not perform much worse than what an abstract or a full text would perform, as in the odds ratio was like 1.4, with confidence interval 0.8 to 2.4. With this background, that about 1/3 of our infographics do not tell what the truth is, we had picked this checklist, the development of reporting infographics and visual abstracts of comparative studies, the Riva checklist and the guide. I don't know if you noticed. So these are the two people who are actually published the same paper. So these are the ones who are also part of developing the checklist. I have not gone into the how did they come up with this checklist, but we'll go straight into the checklist. So it was designed to improve the reporting of infographics, summarizing the findings of comparative studies alone, meant for developers of infographics, that is all of us journal editors, researchers, healthcare providers. It is only for retrospective observational, pre and post cohort, randomized control trials and systematic reviews, but not for case studies, case series, cross-sectional observation, prognostic, diagnostic. So just like so we're all used to CAS checklist now. So just like that, this also has 3 sections. The section A is study characteristics. Section 2B is results, and section 3 is conclusion or takeaway message. So because we're all used to CAS, I tried to simulate it with the same colors also. The first one is study characteristics. So study design, present the study design. So consider, so this is just like the hint that we have in CAS. The infographic should clearly present the design of the study it is summarizing. Example, it has to clearly mention randomized control trials, systematic review, prospective cohort, whichever you're looking at. I've kept some handouts there, you can use it. So I've also put some examples at the end of every point. So this is from the, I will use, henceforth, I will use this visual abstract to highlight the points that we're looking at. So in this, if you can see the red color, it shows that, they had highlighted and they had mentioned that it is a randomized control trial. So another one which should show that there is a systematic review or meta-analysis clearly and mentioned there. The next one is population. Present the population or participants, sample size, and important characteristics describing the population of participants. So it should clearly represent the participants and characteristics important to understanding the participants. Essentially, summary of baseline characteristics like sample size, diagnosis, age, gender, socioeconomic status, symptom duration, study setting. Randomized, for randomized trials, they should have the number of people who are randomized overall and for each group. For single group studies, participants, the number of participants who were enrolled. And for systematic reviews, you have to include the studies that are included, number of participants from each of these studies, how many were enrolled and how many were there. So this is question number 2. So to see that, this is also from the BMJ. So if you can see here, they had 3 groups of participants. They had mentioned the mean age, sex, and the baseline characters very clearly, number of participants in each arm. This is from a systematic review and meta-analysis. So it included 23 studies, 14 included participants using insulin. The 1,400 participants, what their baseline characteristics clearly mentioned. Question 3 is intervention and comparator. Present the intervention and comparator, important characteristics describing them. So you mentioned placebo and no treatment, other treatment. It should also, it cannot just mention Glimepiride or something. Glimepiride 4 mg or what is the dose, how long you were using. So present the characteristics important to understand the intervention and comparators, drug type and dose, intervention duration, who delivered the intervention, all of that. So if you can look at it in this example, they had used approximately 20 mg once daily for further 6 weeks. So initially they had used 15 mg BD, then 3 weeks 20 mg OD. So the duration and the dose is clearly there. Subsequently, they were randomized into 2 arms. In that also the duration is clearly mentioned and the dose. If you can look at it, this is a snippet from meta-analysis. So they had given low and very low carbohydrate diet. So number of studies, 23 studies and 12 studies were mentioned. And what do they mean by low and very low is also mentioned. Next question is outcomes. Present and clearly label the primary outcome, including the scale, units, and time points. So the infographic should clearly present the primary outcomes like mortality and pain, including the scale. So it is very clear if you're taking the scale, what is zero, what is the highest, what is the least score, units, and time points. Presenting secondary outcomes is optional. If presenting primary and secondary, there has to be a label mentioning which is the primary outcome. If the study did not nominate a primary outcome, make it very clear in your footnote. So, if you, for like example, the primary endpoint was a composite of all these things. So they had mentioned that it is primary, and this is for the harms, that this is primary, and the rest of the other outcomes were also mentioned. Moving on to section B, this is the results section. So how much it helps and how certain we are. Present between group effects with measures of precision, that is mean difference and confidence interval, using absolute effects wherever possible to demonstrate the effect of the intervention on the primary outcome. So it should clearly present the size of the effect and the certainty of the effect and the primary outcome using point estimate, what risk difference or mean difference. Absolute effects are preferred. More often than not, we will see if the outcome is like 1% in one group and 0.5 on one group. The absolute is only 0.5, but like they are likely to represent a relative difference is actually 50% in the same group. So it is advised to use absolute differences and not relative differences. The number of participants analyzed in each group or at each time point should be presented. Point estimates and measures of precision can be tried and put it in real language. So if I were to look at this, anybody wants to try reading this? If not, I'll read one and then we can do the rest. So anyways, here if you can see, it's a relative risk we said like the absolute risk. So the relative risk in the, so what we're looking at is the outcomes is in the, I did not put the full picture, but the outcome seems to be favoring. So this is the rivaroxaban arm and this is the control arm. So at the end of 6 weeks, so both one group got 6 weeks, both the groups had everybody got 6 weeks of rivaroxaban. Followed that one group got six more weeks and another one group did not get that. So the relative seems to be maybe somewhere about 0.7 with the confidence interval close to 1 and 1. So this is another from the previous one. This is the systematic review and meta-analysis. So these 858 are the number of studies that were the number of studies that had looked at this outcome. This one is still, this first half is for 6 months and this is for the 12 months. So remember, one of the points they mentioned that it has to be the time frame has to be clear in the at which point you're analyzing it, and it has to be point estimate with the confidence interval on the side. So here it appears that there is difference for remission, which is their outcome, seems to be somewhere between 0.3 to 0.1. And so the color scheme also has to be seen. The green one favors low carbohydrate diet and the red one favors carbohydrate. So if you can look at it, like a lot of thought is put into it, every single detail is trying to be, and then like incorporate into this one picture. Next one is how important are the effects when possible, present the magnitude of between group differences for the primary outcome. The infographic should highlight whether the between group effects of the intervention on the primary outcome is clinically important, if justifiable thresholds exist. So that they would have given it in the sample size calculation, having assumed that this is the difference that we're expecting to have. It can be integrated into the presentation of the results, like a dotted line. So here, if you can get, this is the pre-specified one, and this is the dotted line, which means that we expected it to be at least this much. Next one, whether it harms, present the frequency of serious adverse events in each group and some examples of the most common serious adverse effects. They should clearly present the frequency of serious adverse effects in each group. Let's say there is a serious adverse effect in control and intervention. Some of the most common other adverse effects. It does not report the overall frequency of the serious adverse event group. They can mention just the adverse effects. If the study does not highlight them, you put them in a footnote. So here they say major bleeding, it's a primary outcome. This, and if you can look at this, they mentioned the serious adverse. What is the certainty of evidence? This is for systematic reviews. So present the certainty of evidence for all effects present in the infographic. For all outcomes for which effects are reported in the infographic, the certainty of evidence should be reported also. If the certainty of evidence was not assessed in the original paper, make it clear in the infographic. Presenting the certainty of evidence will allow readers to understand how certain they are of the findings presented in the infographic. Like this is safe that I'm using it. So here 4 golden color lines means that they are high, modestly 2 and 1. So here, if we can look at this, this is not their primary outcome. All this is not their primary outcome because, but they are highly certain that the HbA1c, the reduction in HbA1c favors the low carbohydrate diet in 6 months. And the certainty is presented over here in golden lines. Last section is conclusion or takeaway message. Directness is when including conclusion takeaway message, ensure it is appropriate to study population, intervention, comparator, and outcome. Like we keep talking about directness, is basically how closely is the person in the study close to our population in question. So if they were looking at an 80-year-old old lady, we cannot apply the same results for a 20-year-old boy here. So how close is the study group looked at there here? So how much we can apply it? So a conclusion or takeaway message that is appropriate to the study population, intervention, comparator, and outcome will ensure findings are not over-generalized. The last question, so if you look at it, 6 additional weeks of rivaroxaban after a 6-week uneventful period. So they tried to make it as less controversial by using the word uneventful period. They did not have any problems in the next 6 weeks. Effectively reduce the risk of recurrent thrombosis. On the basis of moderate to low circulation based on golden lines, patients adhering to carbohydrate diet for 6 months might experience diabetes remission without adverse consequences. So the last one is when include primary outcome, when including a conclusion or takeover message, ensure it focuses only on the primary outcome and acknowledge potential harms of the intervention. Conclusion or takeover message that focuses on primary outcome will reduce the selective reporting of statistically significant results. Acknowledge potential harms of the intervention. Presenting findings from secondary outcomes is optional, but I mean, given that you have only so much space, there's only so much you can put in. Except for data on the harms, which is important. So I can just summarize it. In the summary, so this section C, in the text, the section C, if you look at the original document, so both times, this is the concise version. Both the times they mentioned that you need not have to do it if you already have mentioned it in the rest of the infographic. There is no, it is not compulsory thing to have it. Yes, I have some examples. So I thought I'll just summarize it. So I'm looking at one infographic which I've looked at 2 hours. So this is the full infographic that I'm taking from BMJ. So if you can look at your everybody, I printed some checklists. So I numbered each of them. So the study design I have numbered as 1 based on the checklist. So they have mentioned that it is a randomized controlled trial, double-blind follow-up. The second point is population. So they had 448 people with symptomatic isolated DVT. And they had put in baseline characteristics here in the schedule. The third one is intervention and comparator. So intervention and comparators with the dosing and duration I've clearly mentioned. The fourth is outcomes. So they have highlighted that this is the primary outcome. The fifth is how important are the effects. So they had put between group differences, 5 and 6 are together, club them together. They had mentioned the relative risk with the confidence interval and the cost estimate. Harms, they had also mentioned what the harms are. And question number 8 is actually not applicable because that is only for systematic reviews. So for the directness and primary outcome, this is the summary that they have given. Because they already have, so we can use this information for the directness. So this probably counts like an ideal visual infographic. So I thought if we can, I had put in some things, maybe take turns to use this checklist and give 1 minute for everybody to get it and see if any of these comments are missing. Oh yes. So they had mentioned RCT. They had mentioned the population with the scan the number of participants.
Complicated intervention. Maybe you can repeat for the audience.
Yeah. So they had also mentioned that it appears to be a 3-arm trial. One looking at helping with CAT and HYP and BEF.
Okay, next one. Yeah.
Yeah. Okay.
Outcome.
Outcome they have mentioned that they have clearly mentioned that this is a primary outcome. Okay.
Next question. What is the section?
Yeah. So I did not think I thought they could have mentioned the numbers along with the confidence interval because they seem to be overlapping, but they should have given the numbers ideally. They're not very clear from that.
Next question. The effect size.
So I had did it this way. So I thought they should have mentioned the details for how many days of what sessions. Because they have a lot of space like this one. They could have used that. The mean difference and confidence interval should have been mentioned. Directness and they should have had one line on take home message. Directness, we could have used this data. Take home message could have been here. One take home message. One summary sort of thing they could have had there, which they did not have it. So I thought these were the things that were missing. The numbers also moved added to 120. 120. 612. I know these were the things that were missing. Next. Sorry. The graph doesn't really mention, so I think here they said 12 months and there also it says 12 months.
There are two outcomes in the
One graph. Interesting. Java also. Yeah, so this is from NEJM. Please like another 1 minute for this. But they did not mention further details about the new needs, like 1 day baby or 5-day baby. How sick were they? Those details of that were not mentioned. But again, the high flow therapy, they did not mention what FiO2 was the oxygen delivered and for how long. There were details were not mentioned of the intervention. So between the two, we do not know what exactly their primary outcomes. They were not clear about which one is their primary outcome.
And they didn't say what scale you determine successful, not successful. Yeah.
We don't really know which is primary actually. Yeah. Yes. So I thought baseline characteristics of babies, characteristics of the high flow oxygen, what is the primary outcome and harms. So these were the red flags that were, I mean, they did not, these aspects, they did not fulfill the duties. Conclusion, improve the likelihood of successful intubation on the first attempt without physiological damage. So I'm guessing this is their primary outcomes. So this, so I just put this like this. It's not this. Now infographics are being used not just in journals, but on blogs. So this is from one of these Nephro JC that when Twitter with the Lord nephrology posting for Georgie, and I didn't know you were going to come, but it is so this is from Twitter actually. So
Very useful.
yeah.
Very useful for us. They have a recent study, they break it down into the give us all relevant information. Looking at it. Surrounding it.
There are discussions, there keep active discussion happening on the page channel. So for this, I thought that they could have made it a little more clear on what the study design was. They did mention open label and multi-center, but what were the RCT what they were doing. More details about the participants could have been mentioned. Yeah, these are the only two things I thought. Otherwise, it was fairly well done.
Except they have presented the visual aspect in this way. Usually we are used to seeing active group, control group, and then looking down this way. So I was comparing 37 and 10. It's not right. It is actually 37 and 30 and 10. So we get used to. But this way, actually they use more of the space. We used it very nicely. We got more space.
So I thought like, although it was not a journal, this was one of those which had most of the information covered and two more we'll just look at. So this is from COVID times. Okay. So I thought there was nothing mentioned about these 2 lakh, 26 lakh population that they had included. What was the primary outcome? What was the measure of the primary outcome? There was no confidence intervals mentioned. There were no harms. Given that we're talking about a vaccine, there should have been mention of the harms. So that. Now, just two more. We're done.
Okay,
Next turn, anybody else? So again, there was no study design. There was some. Yeah, that is what I wanted to highlight actually. So yeah, so the study design is not mentioned. So take home message. So they had mentioned that growth prevalence in children. Okay, that is understood from English. But stable proportion of positive results over course of study suggests containment measures to be effective. We do not have this information. I mean, there was nothing that mentioned over the course of the study. So how did they come to this? It's the information that we have known. What I want to highlight is that for a cross-sectional observational studies, I mean, you cannot use this checklist for that. That was one of the things that I wanted to know. No, so it is just a prevalence study. Yeah, so none of that was there actually. So the last one, so this was looking at transplant glomerulopathy. So I thought one again study design could have been clear. Baseline characteristics of all those 900 patients, mean difference here. But again, this checklist is not meant for this study design. Thank you.